Hi, welcome to Swallow the Pill. My name is Zena, and I am your friendly neighborhood nurse educator. I have been a nurse for the last 14 years, and today we are going to have a conversation about Lisinopril. Let's talk about it. Okay, so Lisinopril is a drug that is commonly prescribed to all sorts of individuals. Doesn't matter ethnicity. There's numerous diseases that it can be prescribed to help support. But Lisinopril is a commonly prescribed medication, and it's something that I see a lot of people take. But it is also a drug that comes with some pretty serious life-threatening side effects that I don't think a lot of people are aware of. So let's have a conversation about it. So when we can talk about what is it prescribed for? Why do people need this drug? Why do people keep prescribing it? What are the side effects and what comes with those side effects? And I'm going to tell you a little bit about my story surrounding me taking Lisinopril because I have also taken it. Lisinopril is a drug used to treat blood pressure, to control blood pressure, to control hypertension, to keep your blood pressure maintained at a safe level. So oftentimes doctors will prescribe Lisinopril as a means to control your blood pressure. So if you have a doctor that have prescribed this medication for you, it's because they're wanting to keep your blood pressure at a safe level that can help your body to maintain. Sometimes it's prescribed for patients after they've had a heart attack. Sometimes it's prescribed for patients that have had issues with congestive heart failure because it helps to support your heart as well. It's also oftentimes prescribed for patients with kidney disorders, which is when I was taking it, what it was prescribed for me when I had a prescription for it. It was because I had a kidney disorder that doctors kind of wanted to get a handle on. And part of getting a handle on my kidney disease was controlling my blood pressure. Oftentimes, patients that have this drug prescribed for them doesn't necessarily mean your blood pressure is abnormally high. It just means that they want to control the blood pressure so that it can also it's like a fall effect. If you control the blood pressure, you can control the severity of the kidney disease. High blood pressure do a lot of damage to multiple parts of your body. So if you are going to stop taking this drug, just know that you also need to consult your doctor to replace it with something else to continue to control your blood pressure, okay? So like I said, Lisinopril is to control your blood pressure, to keep your blood pressure maintained at a safe level. Blood pressure treats blood pressure. It also is an afterload reducer. What does that mean? In layman's terms, an afterload reducer, there's a number of drugs that can be identified as an afterload reducer. It helps to allow the blood flows from your heart to the rest of your body back to your heart. It helps the blood flow in your body to be able to return easily back to your heart. It also helps the blood flow to your vital organs. It helps to make that blood flow to your vital organs easier. So if you have a kidney disorder and your kidneys are already compromised, meaning something is wrong with them, they're not functioning normally as they normally should, you don't ever want to affect the blood flow you don't ever want to lessen the blood flow to your kidneys. And oftentimes it can, if you definitely have a kidney disorder that is not controlled well, the blood flow can be compromised. So oftentimes kidney doctors specifically will prescribe Lisinopril because it is an afterload reducer, which means it helps the blood flow to your kidneys easier. It helps to make the blood flow easier. So in addition to helping your blood pressure to be maintained, in addition to helping the flow of the blood within your body to be easier, it also comes with some side effects. Some of those side effects are more severe than others, but there's always a side effect to any medicine that you take. But Lisinopril specifically has some side effects that you need to pay attention to, especially if you are an African American, because studies have shown that some of these side effects are predominantly seen in African Americans. And if you don't know what you're looking for, You can be experiencing some of these side effects and not even know it, because when I experienced them, I didn't know. And I was a nurse at the time. I was a brand new nurse, but I was a nurse at the time. Some of the side effects include cough, a consistent cough, a dry cough that just won't go away. Sometimes that cough gets so severe that patients just can't tolerate it, so doctors have to stop this medication for them. Dizziness, lightheadedness, muscle cramps, joint pains, headaches. Some of these side effects patients do experience. Some of them experience them in an extreme manner. Some of them don't. When I was taking Lisinopril, it did give me a cough, but it wasn't severe enough to where, oh my God, let me stop taking this. But those are some of the side effects that you can experience while taking Lisinopril. And if they are severe enough, please feel free to advocate for yourself to let doctors know, I am experiencing this since I've started taking this medication. That way they can know maybe we should explore a different option to replace the Lisinopril, especially if you can't tolerate the side effects of it. One of the biggest side effects associated with Lisinopril is angioedema. What is angioedema? Angioedema is painless swelling under the skin, which means it's swelling that you don't feel, that you don't even recognize, that's not going to cause you any discomfort. So you're not going to feel like, oh my God, what's happening? It's just going to be subtle. And angioedema, swelling of the face, can be pretty severe. It is definitely life-threatening. Why is it life-threatening? If you start swelling within your face, specifically from your neck up, then your airway can become compromised by the swelling. And you might not see all of the swelling. Yes, you might be puffy here, but what about the swelling internally that you can't see and that you can't feel? That becomes life-threatening, because if your airway starts to swell up, your airway can close, which then it compromises your ability to breathe freely. It compromises your oxygenation status. If you start losing oxygen to your brain muscle dies. So if you are taking Lisinopril and you are an African American, because there have been studies shown that African Americans experience this specific side effects more severely than others, angioedema is a side effect that you can possibly experience. What is the angioedema? It is the swelling that can then lead to closing of your airway within your face. If you are taking Lisinopril, be aware of this. If you are taking Lisinopril and you start to experience puffiness around your mouth, your top lip is getting bigger than your lower lip, or vice versa, you need to go to your nearest emergency department ASAP and tell them that you are now having an allergic reaction. Tell them your signs and symptoms, and let them treat you for that allergic reaction. You also need to stop taking Lisinopril immediately. You also need to notify your doctor that prescribed the Lisinopril immediately and explain to them what has happened to you, so that they can prescribe you something else in replace of the Lisinopril. I was taking Lisinopril for 5 years before I ever had a reaction to it. I had been on Lisinopril because my nephrology doctor prescribed it for me. I had a kidney disorder that I was diagnosed with, and the doctor wanted to make sure my blood pressure was controlled. So I started taking Lisinopril. I was just on 5 milligrams of Lisinopril, very small dose. So I was taking it, have taken it every day. It was a daily medication for me, and felt fine on it for years. And then randomly one day I was at home and I noticed my top lip was just a little puffy. And I was just kind of like, oh, this is weird. Why is my lip puffy? And then it progressively got worse. And over the course of days, I was just kind of like, I feel fine, but I don't know why this is swelling. And I continued to take my Lisinopril, which was one of my biggest mistakes. And then finally, things was so profound that it was noticeable. And I went to work and my coworkers was like, what is wrong? Like, why is your lip so big, girl? Like, what is happening to you? And so I ended up going to my emergency room. And they treated me for an allergic reaction, because sure enough, it was an allergic reaction. And things started getting better, but I stopped taking the Lisinopril and I notified my doctor. And of course, they prescribed something else for me, but it was a true allergic reaction. And thankfully, I caught it in time. There have been some people that have not caught it in time and their entire airway has swollen up and they were admitted to the ICU. So I share that story to share. If you are on Lisinopril, just know that that is a side effect that you can experience. Be aware that it is a major side effect that you can experience. And if you are experiencing that side effect, you do need to go and be seen and be treated and let your doctor know. That way you can advocate for yourself and advocate for something different for yourself. Thank you for listening to my conversation surrounding Lisinopril. I hope that it helped you. If it does help you, leave me a comment, like, and subscribe. And if there's questions that you have, leave me a comment and I'll get back to you.